Managing diabetes with berberine. A breakthrough you need to know. In today's video we are going to talk about berberine and its potential health benefits for diabetes. Berberine, a natural compound found in various plants, has garnered attention for its potential to support diabetes management. For those with diabetes, maintaining stable blood sugar levels is crucial. Berberine has been studied for its ability to help regulate blood glucose levels. Studies suggest that berberine may increase insulin sensitivity, allowing cells to better respond to insulin and prevents your liver from creating more glucose. As a result, people with diabetes may find berberine helps lower their blood sugar levels. A study found that berberine was as effective as metformin at reducing blood sugar and controlling type 2 diabetes. Research indicates that berberine might activate an enzyme called AMPK, which plays a role in energy metabolism and glucose regulation. But that's not all. Berberine may also assist in several other aspects of diabetes management. Research suggests that berberine may help lower triglycerides and LDL cholesterol levels, promoting better heart health, which is often a concern for those with diabetes. Berberine may have a positive effect on blood pressure, which is essential since high blood pressure can exacerbate diabetes-related complications. Berberine is a powerful antiarrhythmic compound. It could increase the performance of the heart muscle and decrease the risk of a heart attack. Berberine helps shrink plaque in the arteries and it can help prevent cardiac muscle fibrosis after injury. Anything that decreases insulin resistance will also help support weight loss. Maintaining a healthy weight is crucial for diabetes management. Berberine can act as an anti-inflammatory. Chronic inflammation is linked to insulin resistance, a key factor in type 2 diabetes, and may help improve the symptoms of Alzheimer's. It's neuroprotective. Here are some of the reviews taken from a YouTube video on berberine, which proves the effectiveness of berberine for diabetes management and other related aspects. Berberine is available as a supplement. Incorporating berberine-rich foods like barberries, golden seal, and Oregon grape into your diet could also offer benefits. Berberine is generally considered safe for most people when used at recommended doses. However, it may cause side effects in some individuals, including digestive issues, low blood pressure, allergic reactions, and can interact with certain medications. So it's essential to consult a healthcare provider before taking it, especially if you have underlying health conditions or are taking medications. Typical dosages for berberine supplements range from 500 mg to 1,500 mg per day, divided into 2 to 3 doses. Remember, managing diabetes involves a holistic approach. Regular physical activity, a balanced diet, and regular medical checkups all play key roles. In conclusion, berberine may play a significant role in your journey toward better health. Berberine's potential benefits for diabetes management are undeniably intriguing. It could serve as a valuable addition to your diabetes care plan, with the guidance of a healthcare professional. Stay informed, and as always, prioritize your health. Thanks for watching.